We started off with the poll actually to try and understand whether people felt that this was a good thing. Should the industry be involved in any way? And the attendees were given one of four options: a blanket yes, yes with limitations, a limited role, or no role whatsoever. And about 20% said yes, and then the other 80% said yes with some form of limitations, either sort of moderate or significant. But nobody said no, which was great for those of us in the industry to hear. So what were the points that were raised? I think the first issue that came up, which is sort of top of mind to everyone, is around the question of trust, right? So there's no question that there's this balance in industry where they generate data, they engage early on with new therapies and the gaps in education that might result from that. But at the same time, they have a responsibility to shareholders and a profit motive. And how does one balance this and ensure that that this is controlled? And but it was recognized that, in fact, in general, the relationship with the education community is a good one, and that in the industry as a whole provides significant financial support to educational activities, independent educational activities. So again, there's this balance, and how does one ensure that we strike the right balance? In terms of, does industry have a legitimate role? This was raised, surely in informing and ensuring those that use their products do so responsibly. But at the same time, it was brought up that there should be open and transparent rules and guidance regarding the role of pharma and the limitations in their involvement. And this is particularly when it comes to accreditation and accredited education. And there should be an absolute commitment to independence, governed by strict standards and adhered to, and any potential for bias or influence should be avoided. And that point was made quite strongly. The issue of patient safety and the outcome of patients should be the aim of all medical education programs. But from the perspective of pharma, this could only be achieved if they have a transparent and clear intention and quality in execution. And what does that mean? And that the industry should communicate that up front. So quite clear in what their intention is. And then we finished with an example from the United States, which I'm sure you're all familiar with, where the industry primarily identifies the gaps in education as they generate their data, as they start to understand more how it will impact patient care, and then work with independent educational groups to agree on what needs to be taught, what those outcomes are, but then takes a step back and lets the independent educational team manage the program in its entirety. And this was seen as a best practice. So overall, great participation, good discussion, no final conclusions, but certainly I certainly enjoyed it, and thank everyone that participated. So thank you, Eugene.